Hi everyone, my name is Julie and I'm one of the marketing coordinators with BCIT's School of Health Sciences. It is my pleasure to welcome you to this information session for the Cardiovascular Perfusion program. First off, I want to say how happy we are to see you all and thank you for attending our presentation today. Second, you may post your questions or comments into the chat during the presentation. We will address as many questions as we can near the end of the presentation in the Q&A segment. And third, please keep your microphones off and your video turned off until the end of the presentation to reduce connectivity issues and interruptions. This is greatly appreciated. Just before we get started, I wanted to mention that the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of Squamish, Tsleil-Waututh, and Musqueam. Today's agenda is a welcome and introduction. You already know who I am. I'm Julie. We have Tammy Riley here with us, who's the program head, Ambreen Sharif, a program advisor, and Erin and Darren, who are marketing coordinators with me to help throughout the session. We're going to have a presentation from Tammy, and then followed by that, there will be an open floor for Q&A. Now over to you, Tammy.
Thanks, Julie. And welcome everybody, and thanks to the BCIT team for being here. We're going to pull up a quick poll and just see how many of you know how many perfusionists work across Canada. It looks like probably somebody knows exactly how many are in Canada. There's approximately 300 300 perfusionists that work across Canada. So it's quite a small profession and a niche profession as well. All right, so what is cardiovascular perfusion? It is the mechanical support of the heart and lungs during open heart surgery. So in other words, the heart-lung machine that the perfusionists are operating replaces the respiratory and circulatory system while the body can't function during cardiac surgery. A perfusionist is an integral member of the cardiovascular surgical team, and their role is to operate that heart-lung machine. They're responsible for regulating and monitoring blood flow and safely administering blood products and drugs to maintain the physiological state of the body during surgery. Outside the OR, perfusionists manage and troubleshoot ventricular assist devices or VADs, and they're also highly involved with ECMO or extracorporeal membrane oxygenation. And VAD and ECMO systems are used to support patients who are in cardiac or respiratory failure. Next slide, please. So perfusionists are part of a highly specialized cardiac team and are autonomous in their roles. Prospective students must be prepared to deliver acute level care, function well in fast-paced and high-stress environments. Attention to detail, ability to multitask, and troubleshoot mechanical issues are also typical attributes of a perfusionist, and excellent communication skills are really mandatory. Physical stamina is important as well, as perfusionists work long hours and often have to take call. So all candidates that are applying to the program must have completed a Bachelor of Science degree, and a preference is given to those who have a focus in human sciences. And there are two pathways for applying to the program, which will be discussed in more detail later. But option one is available to respiratory therapists or critical care RNs or other allied healthcare professionals working in critical environments and directly involved with patient care. Next slide, please. So it is a 2-year advanced certificate program. It runs for around 22 months. The first year is delivered in a blended format. There are 2 weeks of lab, and it really requires 100% of dedication on your part to your studies. It is time intensive and a demanding program. The 2-week lab components are held on campus at BCIT to help foster that application of theory to practice. The final year is full-time and is comprised of lab and clinical rotations across Western Canada. And those are quite time-consuming and, from what I understand, quite tiring from what I hear from the current students. Within BC, there are 5 adult cardiac surgical sites. 3 are within the Lower Mainland. We have 2 in Alberta, 2 in Saskatchewan, and 1 in Manitoba that is affiliated with BCIT. The program does expect students to be committed to developing their knowledge, understanding, and hands-on skills. So students who graduate from the BCIT program are eligible to work in Canada and abroad. They also meet the criteria to write the American board exams, which opens up lots of opportunities through the US to work. Starting wages are approximately $50 per hour, but the contract currently is under review. So you can anticipate a bit of a wage jump there. And I believe that it is going to be finalized this spring, I think somewhere around April or May. And I would encourage you to visit the Canadian Society of Cardiovascular Perfusion homepage that is posted here. That's the website there for more career opportunities and information exactly about job prospects. I think this is over to you, Julie.
Hi, everyone. I'm back. BCIT Perfusion. This is a testimonial from Michael Hildebrand, a BCIT Perfusion alum. He says, BCIT Perfusion gave me the expert knowledge and hands-on experience necessary to thrive in the fast-paced and high-stress environment of cardiac surgery, organ transplantation, and critical care. Thank you for that, Michael.
All right, so on to the admission process. This isn't my area of expertise, and we do have Ambreen here for questions, but I will tackle this as best I can. So our program application period actually just closed as of February 28th of this year. So we'll be moving into a new application process for the September 2024 intake, and we will be accepting applications as of October 1st. That should be 2023, I think, right?
That's right.
October,
yeah, October 2023, we will start accepting applications for 2024.
Yeah, and they close February 28th. Thanks, Ambreen.
Yep.
So admission is highly competitive, and in both 2021 and 2022, BCIT admitted 1 in 6 applicants. So successful applicants typically exceed the posted entrance requirements, and they also show a clear understanding of the profession and typically have worked in high-stress environments. And again, we really like that direct patient care contact as well. So application steps, we encourage you to visit the website for the entrance requirements and make sure that you meet all of those requirements. We need you to convert all of the documents to PDF files, which are then uploaded into the BCIT hub, I believe. Ambreen, jump in anytime.
Yes. So those can just be attached with the online application. So when you click on apply now, that's the blue tab under the entrance requirements, you can attach your documents. But if you've already applied and you want to add documents, then you would upload them, yes, to the application through My BCIT.
Great. Thank you. We also ask that a CASPER is completed. It is a virtual, essentially almost interview that happens, and you do need to book that in advance. So it's nice if you can have that CASPER completed ahead of the February 28th application close date. And we also have a mandatory questionnaire that is uploaded with your application. So entrance requirements do include proficiency in speaking and listening. As I mentioned, communication skills are a big piece of perfusion. You're working in an interprofessional team, so good communication skills are very important in this profession.
Can I hop in there, Tammy?
Yeah, of course.
So for the speaking and listening component, that is only really required out of students that have less than 2 years of education in Canada or in a country where English is the primary language. So you can, under the entrance requirements is a link that says, what if I don't meet the English requirements? And this is all outlined in detail in that link. But that speaking and listening component would be demonstrated through some sort of testing like IELTS or TOEFL, but that's only for those that have less than the 2 years in an English speaking country.
Great. Thank you, Ambry. All of the applicants must have a bachelor's degree. Along with option 1, you need to have a stats for health course and 2 years of current work experience as a respiratory therapist or critical care RN or other allied health care professional working in an acute care setting. Option 2, you do need to have a degree as well, along with those specific courses. And we ask that you have completed a patient care and terminology course. We have card 1103 and card 1186 available through BCIT, but we do accept equivalencies. And if you're unsure, you can always reach out, and admissions will often reach out to the program area, and we will determine if we consider those to be equivalent courses. Ambry, do you have anything to add there?
Not really, other than you can contact us at Program Advising. I'm going to put down our services and service hours information in the chat. And I think we're going to have a slide on it as well. But you're welcome to contact us if you're in any doubt about specific courses meeting the requirements. And sometimes the courses will need to be reviewed.
And again, you have to have completed the CASPER process and fill out the questionnaire. So as I mentioned, it is a competitive program, and preference will be given to applicants with post-secondary education with a focus on human anatomy and physiology, and really demonstrate a strong and consistent academic performance. The program is quite demanding, so we do tend to look at previous academic performance. We also look for recent and sustained work or volunteer experience involving direct patient care, and again, ideally in an acute care setting. It is important to have a demonstration and clear understanding of the profession and the program, and again, excellent communication skills. So there are a few ways that you can upload your information. I think that we will accept images of official transcripts, and you can download your digital transcript from your school and upload as well. It says that official transcripts aren't required from BCIT, but I know that's not quite true, is it, Amberine, based on our last?
Yeah, it's a scanned version of the official. So you need a scanned version of the official one. And if for any reason admissions is not happy with what they see, then they may request the hard copy. We're not asking you to send hard copy documents at this point.
And we don't recommend mailing in any kind of transcripts. So how it works is once you've applied to the program and you've uploaded all of your application documents, admissions, which is separate from the program area, review to make sure that everything meets the entrance requirements. And then what happens is the admissions forwards all of the completed applications to the program area. And then the program, we review all of the questionnaires of all of the applicants and all of the documentation as well. And essentially, we go through all of the applicants and determine which ones may have a better chance at being successful through the program. Once we decide that, we then reach out and ask that prospective students come in for an in-person interview at BCIT. So we have a specific process here that we follow. After that happens, we then reach out and send letters of acceptance. And then you have to pay the commitment fee. And we shortlist a few applicants as well in case somebody doesn't take the spot. But those people who are shortlisted it doesn't mean that they're now on the wait list for next year. It's a new process and competitive process the following year. All right. I think that's where I end, and we'll pass this on back over to Julie.
Hi, everyone. I'm back. Now, moving from the academics, I would like to let you know that BCIT is committed to supporting students in a holistic sense. We want you to succeed not only in your academics, but also outside of school. Some of the student services are available to you as a prospective student, and others will be available to you once you become an enrolled student. Here are some of the important student supports that I'd like to mention. If you are Indigenous, BCIT's Indigenous Initiatives Department is there for you to ensure a smooth transition into your first year. They offer peer-to-peer mentorship, a welcoming gathering place, and provide clarification on Indigenous funding. BCIT's awards, scholarships, and bursaries are listed on our Financial Aid and Awards webpage. I would like to mention that we have a President's Entrance Award, and selection is based on academic achievement and also volunteer and community service. Please contact Financial Aid directly for more information. BCIT is committed to providing assistance for students with permanent or temporary disabilities. If you have been accepted to a program and believe you may need accommodation to be successful, I encourage you to connect with our Accessibility Services Department. BCIT Student Health Services is a health clinic located on the Burnaby campus. They provide medical care for current BCIT students year-round. We also have a counseling and student development department available to help you enhance your educational performance and maximize your success as a student at BCIT. Our Recreation Services Department promotes, encourages, and enables the practice of physical well-being. We consider recreation an integral part of campus life and welcome all students to enjoy their services. Please don't hesitate to contact Program Advising if you have a question or are unsure of something. They are able to answer questions regarding entrance requirements, the application process, student resources, success strategies, program schedules, and many other details as well. They are available to assist you via telephone, email, or by in-person or virtual appointments. Please go to their webpage, bcit.ca/advising, for their most up-to-date contact information and service hours. If your inquiry is time-sensitive, please call them during their telephone advising hours. This is the best option to get your questions answered quickly. We welcome and invite you to connect with us via social media on Facebook, Twitter, Instagram, YouTube, or LinkedIn. If you wanted to take a tour of the campus, spend a day, attend a big info session, or another info session, these are all of the links. This whole presentation, a link, the slide deck, and a link to the recording will be emailed to you next week. So there's no need to take any screenshots or scramble to write this down. You'll get it in your email. And now I'd like to open up the floor to any questions that we may have. Please feel free to post in the chat your questions, or unmute yourself and ask, or you can send a question to one of us directly if you wanted to remain anonymous.
So far, nothing in the chat. I know one of the questions that comes up, Tammy, a lot is the preferred degrees. So in terms of, the successful applicant, if they are applying under option 2, are there, and say they were just starting out in terms of picking up the prerequisites for the program, coming out of high school, wondering, or having done maybe a year post-secondary and wondering what kind of degree program would be best suited for this line of work. Could you speak to that?
Sure, that's a great question. As I mentioned earlier, it's nice to have a science degree that's focused to human sciences. We get a lot of applicants with kinesiology degrees are quite good, I would say. Human kinetics might be another one. There's quite I think a multitude of degrees out there. And I would encourage you to put in an application anyway. A lot of times we look at the application questionnaire, and depending on experience, volunteer experience, and basically, it's almost selling yourself a little bit, I think, Ambreen, as well, in the application.
So we have a number of questions now. Julie, did you want to maybe read some out?
Sure.
Or do you want me to do that part?
No, I can do that. Selwyn asked, hello, I'm a perfusionist from the Philippines and migrated here in Canada. I have a bachelor's in medical technology, but WES, which I'm not sure what that is, but Selwyn, you might want to put that in the chat.
Oh,
do you know?
Yes, the WES evaluation is sort of an equivalent one to ICES. So for those that have their education from outside of Canada, US, UK, Australia, New Zealand, an ICES evaluation is needed. And we have an office at BCIT that does these evaluations. It's basically just an evaluation that shows equivalency for that country with Canada. And so that process can take a few weeks. You need a comprehensive one. We do accept WES, but a WES evaluation would have to be a course by course breakdown, so a comprehensive one as well.
Thanks, Humphrey.
Yeah.
We have another question. Historically, how many applicants are there and how many spots are available?
So we run an annual intake, but every other year we accept students from Alberta, Saskatchewan, and Manitoba. We typically take 5 or 10 students. So alternating years, we focus on BC applicants, and then every other year we take in more. But having said that, we have accepted students from out of province in non-out of province years based on the requirement or need from the provinces.
So there's a question further up, Julie, that I think we missed that had a few questions in it.
Oh, I see that now. Can
Yeah.
you apply to the program if you are in the last year of your degree?
So short answer, no, you need a completed degree prior to the deadline in order to be a competitive applicant and not have an incomplete application.
How much of a role do grades play in the application process? Was there an average recorded for those who were accepted last year?
Tammy, did you want to speak to that one?
Typically, we're looking kind of for a B average. And when I'm looking at grades, I can appreciate that when we first maybe step into the university environment, it's a big change from high school and grades may be a little bit lower. So I always look, me personally, when I'm reviewing applications, I'm looking sort of for that kind of increase in grades throughout the degree. And Breen, feel free to add from your point of view too.
Looking at number 3, it's talking about, it's sort of related, talking about how much you would need to exceed the requirements. So I think it really depends from year to year on the applicant pool, whatever. I know this program is extremely competitive, so the higher your grades, the better. I don't think we actually track the exact GPA. Do we, Tammy, from year to year?
No, we don't.
No. Because it's also a number of factors that are considered in the selection process. Grades is one consideration, right?
Yeah.
And then the next part of the question is, what are some of the other examples of patient care for someone who is not an RN or respiratory therapist?
Allied healthcare professionals. We've had sonographers come into the program previously. We've had some people in the research realm come in as well into the program. There isn't just really kind of one factor, but a hospital greeter doesn't really meet the criteria for direct patient care.
Thank you, Tammy.
And Breen may have something to add as well.
Yeah, no, I think that sounds about right. And then the last one is, are students paid during clinical rotations? I don't believe so. No. Okay. And then the last one, do you provide job placements after the 2-year program?
No, we just provide clinical placements. So you meet the basic entry requirements of a perfusionist, but it is up to you to find your own job after the program. And was there any more questions around the international process? Sorry, Julie, I may have missed something.
I don't see anything. Did you answer the CASPER question about how heavily is CASPER weighed?
There's a number of factors that we take into consideration, and CASPER is a small portion of that.
I have a description of CASPER, which I had written down for one of the information sessions for anyone who doesn't know what it's about. So I thought I would share that. It's an open response situational judgment test that evaluates aspects of your social intelligence and professionalism, such as ethics, empathy, problem solving, and your collaborative skills. So it's sort of like a soft skills test.
I received one question from somebody who said they might have missed the answer, but how many people are admitted each year?
Oh, yeah. So alternating years, we have 5 students typically that are accepted, and then alternating years up to 10. It's a small program. And that's a part of the piece of the high competitiveness of the program.
At this time, then, I'd like to thank Tammy for that wonderful presentation and Ambreen for her insight on the advising portion. Thank you, Erin and Darren, for helping behind the scenes. Like I said earlier, you will receive a slide deck and a link to the recording in your email early next week. Have a great afternoon, everyone.
Thank you. Bye-bye.